disculpamos que estamos unos minutos tarde, pero estábamos preparando para mostrarles cómo es el llenado de la jeringa. Se los vamos a mostrar más adelante, y a los que están presentes, pues muchas gracias por estar aquí. Gracias. Muchos de los que están aquí pues ya vieron esta presentación ayer y los días que nos han acompañado, pero tenemos otros doctores que nos están acompañando desde vía Zoom. Entonces vamos a hablar brevemente de quiénes somos. Pues hoy en el lanzamiento de PROMOITALIA Guatemala, nosotros Corporación TIVA Internacional, bueno, primero que nada queremos agradecerles por su tiempo. Para nosotros lo principal es su tiempo. Sabemos que han dejado pacientes, que han cerrado agenda, y realmente lo apreciamos y esperamos que realmente este evento sea de mucha rentabilidad para ustedes en un futuro. Estos son los hashtags del evento y las cuentas que pueden etiquetar en las redes. Y nosotros, Corporación TIVA Internacional, estamos divididos en dos unidades de negocio, una que es TIVA Beauty, que va enfocada más a esteticistas, a productos tópicos, tratamientos tópicos, y luego tenemos TIVA Med, que son productos cosméticos o intradérmicos, ¿verdad? Que va enfocado más al segmento de médicos. Y básicamente nos enfocamos mucho en vender productos de alta calidad, ¿verdad? Porque sabemos que si ustedes ofrecen alta calidad al cliente, el cliente regresa a ustedes y ustedes pues obviamente van a regresar a nosotros. Podemos ver las macrotendencias, nos enfocamos muchísimo en macrotendencias, más que todo de Europa, de Asia, ¿verdad? Es donde nace la innovación de productos, qué es lo que está trending, ácido poliláctico, qué es lo que está trending, los peelings, qué es lo que está trending. O sea, eso es lo que tenemos que ver más allá del día a día, más allá de lo que tenemos cerca. Muchas veces nos enfocamos tanto en el trabajo que se nos olvida ver qué es lo que los usuarios están viendo en las redes, ¿verdad? Algo muy importante en las redes es el tema de la perfección. Ahora los filtros, o sea, todo el mundo quiere ser perfecto a través de filtros en redes, y eso nosotros lo podemos hacer con medicina estética. Nosotros en TIVA Medic tenemos todos los productos para que ustedes le puedan ofrecer a su cliente verse como que si fuera filtro. Ojo, que hay filtros que hacen una rinomodelación a otro nivel, ¿verdad? Pero podemos acercarnos más a dejar a la persona como el filtro que más le gusta, ¿verdad? Entonces, y lo más importante, ofreciéndoles productos de alta calidad. Y por último, es que nosotros no vendemos productos, nosotros vendemos autoestima a nuestros clientes, ¿verdad? Entonces, mientras más soluciones tengamos para nuestros clientes, más contentos van a estar con nosotros, y no solo van a estar contentos, sino que nos van a recomendar y van a regresar. Les voy a presentar a Andrea Arias. Andrea Arias es la gerente de ventas de Latinoamérica de PROMOITALIA, nos está acompañando el día de hoy, y el cirujano plástico, el doctor Ahmed Siliha. Él es conferencista a nivel mundial de la marca, su nacionalidad es egipcia, y justo están en un tour por Latinoamérica, ¿verdad? Y pues ahorita están en Guatemala, y nada, pues gracias por estar aquí y vamos a empezar.
Bueno, buenas tardes a todos. Creo que ya nos conocimos ayer algunos de ustedes, y esta mañana también. Les agradezco de nuevo la presencia, que hayan vuelto, que hayan estado interesados en la marca, en algunos de los productos que sé que ustedes tienen ahorita, algunos clientes o algunas personas interesadas en ellos. Hoy es bastante interesante porque vamos a hacer demostración de nuestro bestseller en la compañía, que es SKINFILL. Es aquel, digamos, filler corporal, uno de los primeros que en este momento han salido, porque hablando también ayer de las personas que no estuvieron, los doctores que no estuvieron, pues existía un filler corporal en su momento que causó mucha sensación digamos, en el mundo de la estética, y bueno, fue como salió y fue un boom. También fue retirado en poco tiempo por algunas características que fueron nocivas en la forma de aplicación y también cómo quedaba en el cuerpo. Vamos a dar entonces inicio a este workshop interesantísimo de nuestro bestseller de la compañía. Todos los productos que ustedes pueden ver el día de hoy y los que vamos a ver más adelante, y los que Gabriela, que también quiero agradecer muy bien a nuestro partner aquí en Guatemala, Beauty, descriptiva para que, bueno, sé que va a ser una grande labor, está haciendo una grande labor y estamos aquí para apoyarlos a ustedes, doctores, y a nuestro partner aquí en Guatemala. Entonces, sin más preámbulos, vamos a dar inicio a este workshop donde vamos a tener las características. Ustedes, doctores, van a ver los principios activos de este gran producto, contraindicaciones que por ahora no tenemos, pero vamos a dar, digamos, de esta forma lo más preciso, lo más importante para que ustedes tengan claro qué tipo de producto es SKINFILL Body. Les presento entonces al doctor. Para los que no conocen, el doctor Siliha es nuestro speaker internacional de la academia en Milán. Tenemos una academia bastante grande de nuestro laboratorio donde capacitamos a los doctores en más de 119 productos que tenemos de todos fabricación Italia. Algunos de ellos tenemos certificación FDA y la mayoría de ellos y todos los que tenemos en el plantel que son medical devices y dispositivos médicos, también como cosméticos, cuentan con todas las regulaciones de la Comunidad Europea, que más adelante el doctor les explicará cuáles son los beneficios de tener productos con esta certificación. Doctor Siliha, le dijo entonces aquí a este gran público.
Hey, it's okay. That's all right. Okay, hello everyone. I have the pleasure to see you again. Some of you are familiar faces for me. It's a pleasure to be with you again. Is this one live? Is this one also on Zoom? And do you want to check with them if I need to speak only in English or not? Yeah? Are you sure? But the doctor here doesn't speak English. Okay, okay. And what about the Zoom people? Sorry? No. Go. I saw them when I was up. We don't have to translate so many times. For those of you who didn't come yesterday, so I will just speak today about body fillers. Of course, now it's a very trendy request in our daily practices. I don't know the situation here in Guatemala, is it becoming as trendy as in Egypt or not, but in general it is going to be rocking everywhere. Everybody now in our age group, in our clinics, they all have face fillers. 90% of the women who comes to visit our clinics, and around 30% of men. But the interest now is shifting to having a more perfect body as well. So a lot of people now are demanding, or they are looking for having a more perfect body looking. So you would see even people now are more caring about exercising, taking care of their shapes, asking about fillers in the buttocks, especially in the calves. So today we're going to speak about this topic. It's a very interesting topic. We are introducing today a SKINFILL body topic, which is body fillers that is made of hyaluronic acid. Of course, I mentioned that yesterday, but I will mention it also today, that after COVID, people now are more eager to try new services. More new clients are visiting us, not only our old clients, no, they are returning with a lot of newcomers to the industry of aesthetics. So this is a golden chance for us to provide them with different types of materials that is safe and use this chance to help our clients. What is the characteristics of body fillers that are unique or they are good? I want to speak about two different topics before we go into our product. The first one is that I know a lot of people here, even myself, even some doctors in a lot of regions have had a bad experience with body fillers before. There is a brand that is very famous that has caused many problems, and this is because it was not, the material was not made of hyaluronic acid. The only problem was of having hyaluronic acid fillers for the body is that the cost of production was way too high because the molecules, the molecular weight that we have been manufacturing was a little bit smaller than to provide at a cheaper price. Another thing, the first hyaluronic acid that was introduced for the body was for a very famous brand of fillers, and I don't want to say the name, but it was made up of different molecular weights of hyaluronic acid. What does that mean? They had free hyaluronic acid, they had low molecular weight, and high molecular weight. Everybody here is aware about how important the molecular weight is? Or shall I just go a little bit into the details of it? Okay, the molecular weight is simply the size of the molecule. So as many molecules you're going to bind together, you're going to increase the molecular weight of your product. And having free hyaluronic acid, which is the lowest molecular weight, this was added to this company, and then when they injected it, they were trying actually to help the skin of the patients, but after 2 to 3 weeks, the patients, especially who had it injected in their calves, they, after your body starts to consume the free hyaluronic acid, they had goose skin, ups and downs, because of the different molecular weights of the product. And this is why we have created, a filler that is macromolecular. Its molecules are big enough, very high molecular weight, but in the same time, only one type or only one molecular weight that was present. The cross-linking agent is BDDE, and it's highly cross-linked, so this ensures a long duration and at the same time homogeneous reabsorption. Lastly, it is the handling and plasticity, which is having a filler that has a thixotropic characteristic. What is a thixotropic characteristic? It's the ability of the material to change from a semi-gel consistency under pressure to become more semi-liquid. The most famous example for that would be ketchup. You have ketchup, you have the bottle, and you just roll it. It doesn't go out of the bottle. When you squeeze it, then it's pressure, it becomes more fluid, and then it goes out because you add more pressure to it. And then as soon as it goes to your plate, it just stays where it is. It doesn't move. It's because it has a thixotropic characteristic. So SKINFILL body topic We have it in a monophasic, like only one molecular weight, macromolecular structure, like a huge molecule, in small particles, so it is easy to be injected, and a highly cohesive characteristic. Having a high molecular weight with a high cross-linking power or cross-linking agent with a high degree of cross-linking, this ensures that you don't have much swelling, because in the end, the free molecules that are able to attract water, or the water gets attracted to attach to these molecules, is mainly going to be less in surface area. So the patient gets an immediate result, and the result that she has will typically be the final result that she will get. I think there is only a little bit of improvement, around 20 to 30% after 10 to 14 days, when the gel starts to attract the little amount of water. There is no much extra swelling that she will feel. She's not going to feel puffy after the treatment, thanks to the high cross-linking agent. So I spoke already about all of these. The technical characteristics of the product is at 20 milligrams per ml. The pH is neutral. The cross-linking agent is BDDE of a 10%, but the residual is less than 2 ppm. This means that it is safe to be injected. You're not exceeding the safe margin of BDDE. To have a toxic dose from these bottles, then you need to inject 15,000 bottles of them, which is a huge number. I don't think anybody is going to have it. And the duration of the material is 18 to 24 months. I have tried the product already for more than a year, and the clients that I have tried the products on, they are still having results, and they're happy. Actually, I had one of them, again, in Paris, that she got re-injected because she was happy. I mean, she didn't have loss of the results. She's actually adding more. The indications, of course, the indications are going to be buttocks, buttocks, buttocks. And then you can have some calves and depressed scars, cellulite, any area that you have experienced of loss of fat, like an accident, any form of necrosis that happened to the fat. But these clients, I mean, they will be the least to visit our, the percentage of them will be the least that are going to visit our clinics. The SKINFILL body, how to prepare it. Actually, I invented like 10 minutes ago a new method. But I will send it to them. It's much easier. Much easier to withdraw, but anyway, the one that is in the presentation, it is, we add 10 mLs of saline or physiological solution to it, and then we shake it so it gets less viscous, and then you start to withdraw it with your syringes. You either prepare 5 of 10 ml syringes, or you can do like what I show you today. I have 20 cc. It's the same. I mean, in the end, you're gonna calculate how much amount you need. It is also very important to mention that we have this product. We have this product in camouflage because it's hyaluronic acid. It's injectable. It's sterile. And it is 50 milligrams, 50 mLs. I already prepared the two vials. I left the third one so that we see together my new technique. Please. No, I didn't add anything. This is just still raw. I'm going to show you. She asked me, it's okay, it's okay. She asked me, did I already add the 10 mLs of saline solution to that one? I said, no, it's still with a cap. I'll show you a trick that I've just tried now. Later, when we are about to do the practical part. What are the average quantities needed? I think it's highly variable from one client to another, actually from one ethnicity to another. If I add a cup of water to a 1 liter, it's about 25% more. If I add a same cup of water to 10 gallons, it's not going to show a huge difference. So in the end, it depends on how much fat volume we already have. What is the ethnicity of the client? Like French people, we cannot match them to the classic South American ones. I mean, like they already have good buttocks volume. But for illustrative purposes, we can just say that the buttocks would take around 50 mLs to 300, which means 150 per side. This is in one session, of course. The arms will take 10 ml to 50. The calves will take 20, around 50 to 200 mLs. And this is all dependent on the client and the results that she's expecting. Lastly, the cellulite and scars and holes, these are all dependent on the amount, the number of holes that we have, the depth and the width of each. But in general, you might use one full bottle for these problems. Today's agenda, we must indicate that not all buttocks look the same. Ethnicity plays a major role in the different shapes. So you can have the classic Caucasian shapes, you have an Afro-American variations, and then you have the classic Latino curves. From my point of view, it's very difficult to shift one person from an ethnicity to another. It's difficult, it's not impossible, but in the end it needs a lot of material, it needs a lot of work, and most likely it will look a little bit fake. I always believe in beautifying what I have, not into shifting one person to another. That's my philosophy, but as Andrea told me yesterday, this philosophy is a little bit different here, and they would love to do some art. So again, as much amount of product you will use, you will be able to change from one shape to another. In a recent study that we have done on a 134 or 32 women, we have concluded that buttocks have 4 shapes. V-shaped, which is the least attractive, square-shaped, rounded, and the inverted heart shape. The inverted heart shape is the one that everybody's looking for, and this is the most attractive. And to achieve that, we have 2 types of measurements that we follow. The classic and most important waist to hip ratio, where we measure the width of the waist and divide it to the waist of the hips. The classic ratio was, and I say was because it's changing with time. Now we're seeing a lot of change. The ideal was 0.7. In a very recent study, we have concluded that it has shifted to become, the taste of the people are changing to become 0.63. In the end, I feel even this ratio is going to change, because when I look at those pictures, I realize that I feel that I like the last one, which is, this is to my taste, is even better. And a lot of people would shift to that opinion. But also to know that, we need to notice that the buttocks are almost the same size in both cases, in the last 2 pictures. The difference is mainly in the waist. So this is just an indication on the importance of also advising your clients of having more lifestyle modification. We actually help our clients. We are not the tool that change their life. We are a tool that push them, like a push to have a better start. So I encourage clients to do sports. We can even use our own hands or our own tools to help reduce the waste width, whether with cryolipolysis, liposuction, whatever the specialty that we are talking about. But in the end, there are some maneuvers that can help them. It's not the topic for today, but this is just an example of having combined treatments. Lastly is Anthropometric Analysis, where we have 3 lines. The first line is a trochanteric line. This is point number A, and then point number B is a maximum projection point of the mons veneris, and the last point, which is C, is the maximum projection of the buttocks. And the ideal ratio would be A to B equals A to C equals twice A to B. And this is evident in the squares, if you can notice that. So this is a good buttocks shape or ideal. What are the depressions that we have in the buttocks area? We have lateral depressions, which is a depressions that we will be able today, or I didn't see the client yet, but this is what we will learn a lot today, how to resolve. It's actually, the fillers will help us a lot to change, to correct the lateral depressions. And number 2, we have the infragluteal folds, which is very nice to have the rounded shape or the inverted heart shape. Number 3 are the supragluteal flossettes. They are beauty signs. And lastly, the V-shaped crease. But who comes and seek for buttocks augmentations? A lot of people. You can find some women coming into my clinic. They're asking me for, we want to have a bigger volume. We like to have, we feel that we have lost some volume. We feel like we are aging. I feel like it's saggy. I'm getting older. That's it. I think that's most of the common comments that we have. What are the treatments that we have? We have surgical and non-surgical solutions. Surgical solutions will be the fat transfer and the implants. Non-surgical solutions, some devices, polylactic acid injection and hyaluronic acid injection. In the same study that we have done, we have found out that 70% of the clients who actually are interested on having their buttocks beautified, they reject the option of surgery. And this is a huge opportunity that is lost if we don't use it today. It's a client who's already interested, she wants to do a procedure, but in the end she is scared to do the surgery. But why can they be scared of the surgery? The first, I think the prioritization here, or the list, is a little bit shifted from my point of view. The first thing is that they are scared to go to the OR. A lot of people, including myself, I'm scared to go to do surgery. I'm scared from the anesthesia, to be honest. I don't know why. I'm a plastic surgeon. I go into the OR every day. I know a lot of good anesthesiologists, but I'm a person. I'm a human being in the end. I get scared. Second, those clients that we have, they are more interested in how they look. So it's not easy for her to accept a scar, regardless if the scar is not going to be showing, and we're going to put it on the fold, blah, blah, blah. All of this are things that we say to the clients and actually we deliver, but it's not matching her brain or the way she thinks. It's very difficult for them to accept general surgery, the scars. Of course, some of them are afraid to have a foreign body material, silicone. They are scared. I don't know why, but in the end, they are scared. And the most important also thing that they don't know how would the final result be. I'm promising her that her buttocks is going to look bigger and much nicer. I tell her the size of the implant, but she can't imagine how it is. We have some softwares that are being implied in some clinics, regardless their prices, but in the end, they don't give you the final true shape that she's going to have. So injecting a filler is going to be a much better option because it can be done. It can be done in it can be done in the clinic in 15 minutes. You can do your result on many sessions, not necessarily. So today I can put for her 50 mLs and 50 mLs. She can come back after 2 to 3 weeks. Okay, I need more. So I add more. It's a 15 minutes procedure. For me, it's okay. To be honest, it's super easy. It's much easier than injecting fillers in the face. It's much, much, much easier. Takes less hassle. For me and for the patient, it's very easy. There's no downtime. She can get back to her work. She can get back to her life immediately. There's not much precautions to be taken. And today I will discuss the different precautions. A little anatomy so that we know, but in the end, before I speak about the anatomy, I want to clarify that our injection level is going to be subcutaneous. We just need 1 or 2 centimeters of thickness of fat to cover my material, and this layer is completely safe. You don't have any important or dangerous structures pathing there. So as long as you are in the right plane, we're using cannulas that is blunt, and of course of a very wide gauge. So you are totally safe. But in general, so that it's a scientific meeting, we can speak about the gluteus maximus. This is the thickest muscle that we have. The thickness ranges from 4 to 7 centimeters, different from one person to another. It originates from iliac crest, or the sacrum, the coccyx, and the sacral tuberal ligament, and it gets inserted in the rough line, the gluteal tuberosity, and it gets its blood supply through the infra and supragluteal arteries. But what can we obtain today? Today we can obtain 3 things. First of all, I can inject in the yellow zone where I get projection. The second point is that I can increase the upper volume to get the rounded shape. And lastly, I can inject in the blue point, which is the trochanteric depressions, to have some lifting and contouring. What are the contraindications that we have? It's like a normal case of filler injection. I wouldn't inject it to a patient who has severe autoimmune disease because I can elicit an attack. I don't inject it to people who have coagulation problems, people who are taking anticoagulants. I don't inject it to people who are having infections under any reason, dermatitis, any other form of infection. Radiotherapy in the gluteal area, of course, this is very logic. And in the end, those last 2, for me, are relative indications. They are not a final contraindication because, as I said, we can take our results step by step. I don't have to put all the 300 mLs at once. So I can, if she is having a very low BMI, meaning also that she has a skin fold that is less than 2 centimeters, I can start with putting 10 or 10, 20 or 20, and then let her go. She comes back after 2 to 3 weeks. Her skin is much more hydrated. Her skin is, the collagen production and induction can be used. We are going to speak also about another product, which is polylactic acid today. So we can put polylactic acid as well, REACH-PL. If we put REACH-PL before it, then she has more fiber and more collagen. She has a better skin, so it can accommodate more fillers. How to proceed? First of all, ask them to sign a consent. Second of all, take the 5 pictures. A picture in the middle, a picture 45, a picture 90 degrees, and then the next side. Then, most importantly, is to note the asymmetry. People do not believe that they do have asymmetry. I always tell my clients, you have two sides. They are not twins. They are sisters, but not twins. They look alike, but they are not a copy and paste. She noticed some of them. They noticed the asymmetry in the face, but not all of them. But they definitely, all of them, they notice the different sizes of the breast. But definitely none of them will be knowing that also her buttocks is going to look asymmetrical. So I usually take pictures, I show her as much as I can, I tell her, because in the end she's gonna show it to her boyfriend, to her husband, to her whatever, and then she's gonna think that you did a mistake just in case. So I usually protect myself, I discuss with them everything, and then I talk to her and I ask her about her demands, her needs. What is she looking for? And then I also speak with her about my opinion, about what she said and about what I have. In the end, I match both opinions to more towards what she's wanting, not my taste. She's not going to be my wife, she's not going to be my girlfriend, so I shouldn't care as long as it is safe. I don't deliver fake results, so I only have two options if she is demanding something. So I either see that this is matching my taste, that's okay, or I can deliver this result, so it's okay, or I will not be able to deliver that result, or I feel I don't want to do that, so I ask her to leave. These are the two options that I have. Once I decide that, so I realize also while looking, with speaking to her, to trying to imagine which is the area of volume that I will increase, how much products that I will need, and what is the point of access of my cannula. The drawings, there are actually, these are very easy ones. So in the beginning, I ask my client to contract her muscles and relax so that I have the ability to define the final shape of the buttocks. Then I do my measurements. I divide my buttocks into 3 equal segments, horizontal ones. The lowest segment for me is a no-go area because usually it creates more sagness. In the end, you have 2 upper segments. I measure the width and I divide them into 4 equal quadrants. The meeting point of those 4 quadrants are going to be the point of my maximum injection, or maximum projection. If I want to enhance all the volume, then I will inject in all 4 quadrants, and then I will add also some in the meeting point so that I increase the projection. If I am looking for contouring, then I will usually inject the upper lateral quadrant, and this is going to be a very good, it's the same concept like the face. If you want to lift the face, then you go on lateral and upper and inject to create some lifting. Lastly is the Brazilian buttocks, or where you want to augment a lot. I would usually do the same drawing. I wouldn't do, this drawing is a little bit different, so instead of going into 2 different drawings and start to lose track, I usually do the same first drawing. I increase the circle of the meeting of the points. I just increase the projection point in width, in diameter, and I inject the upper 2/3 of the lateral quadrant. Not the upper quadrant. I inject the upper 2/3 of the 2 quadrants. Lastly, there is also another beautiful technique for Dr. Estrada. He has, from Ecuador. He has a beautiful technique. I saw it on videos, and you can check it on his Instagram. It's very nice as well. Didn't try it yet because he's injecting using an ultrasound. I didn't get much time to sit in one place actually to try it, but I think it's a beautiful result. The procedure of injection, we're going to see that live in a few. I only inject anesthesia in the point of entry. After injecting the filler, I just determine which is the injection point that, or the entry point for my cannula, depending on the length. Today I think we have a short cannula, so it will be a little bit tricky to apply, but anyway, we will see. I only apply anesthesia in the point of entry, and that's it, and that's all. Most of the clients, I actually have never injected anesthesia in the tract. I never had a patient who were too much in pain, never, until today. I don't know, but anyway. If she is like too thin, then maybe your cannula is hitting the muscle, and then maybe it's a little bit painful. So in this case, you might need to inject the lidocaine also in tracts of the filler or in the tracts that your cannula is going to be moving in. After I finish my injections, I apply some ice to decrease the edema or the swelling from the movement of the cannula. I don't apply garments, but I ask my client not to sleep on her back for the first 2 to 3 days. Gym, exercise, sauna, jacuzzi, any form of heat. Swimming is forbidden for 5 to 7 days. Lastly, and most importantly, it's also she shouldn't sit down a lot in the following next days. She should take an antibiotic. For me, this is a very important thing. I don't know the antibiotic policy here, if it's like the States or not, but in the States they don't give antibiotics. I mean, they're too scared to go. I mean, in our region, in Europe as well, we are more open on antibiotic usage. It's very important because this is, in the end, it's a very simple, easy, and takes 5 to 15 minutes, and your job will be done. I don't want to have infection. I don't want to, it's better for me to give her a course of antibiotics that she can take for 7 days, and I'm safe, she's safe. In the end, I always say, not everybody of us is able to work in a sterile medium. This is point number 1. Point number 2, I can do a sterile medium, I can work in a perfect condition, but my client, she's not caring about herself. She doesn't change her underwears, whatever the reason of infection she can have. I can't control that. So I would cover with antibiotics, make sure that everything is okay. She goes to have a shower the same day, so why? Anyway, some before and after cases that we get done. This is a before and immediately after with a 40 mL per side. Again, the clients will have an improvement 20 to 30% in the following 10 to 14 days. It's also important to note that sometimes they get, or actually most of them, they will have a hard, like it's gonna feel a little bit hard for the next 1 or 2 weeks. It takes around 10 days, and then everything is smooth. The filler is integrated with her own tissues, and it's soft again. This is a before and after immediately, 40 mLs. 50 mLs, 70 mLs, and we're done. Anybody has any questions? I usually give Augmentin. Augmentin is fine. I ask her just if she has any allergy to it, or if not, I usually go for Augmentin, 1 gram every 12 hours. She finished the course in 5 to 7 days, depending on the box. That's it. I think he's asking about Dr. Estrada's or mine. Mine, I think we have some. We have some, but I am very bad with social media. I have a social media account. I post the stories. Like if you take a picture of me, I will reshare it. That's it, and that's all. I take some pictures in my clinic, of course, to do before and after. I never get a chance. I am very bad. I take videos, yes, but I need somebody to edit them, put them together. But I don't stay in one place. So I'm sorry, it's my mistake. But anyway, I think they have something in the office. I think we have the Paris one. I think. Okay, perfect. So we have subcutaneous fat. Any more questions? The case? No complications. If you work in a very nice way, no complications. Why? In the subcutaneous fat, you have 0. If you go inside the muscle, then it's something different. And for you to go, I mean, with all due respect, I mean, you're not like very muscular, okay? But for you to go with an 18 gauge cannula, like a little bit wide and not blunt, and you hit the muscle, you're not going to penetrate the muscle. So it's for you, it's everything is safe, as long as I always deal with the tissues as if I'm dealing with a woman, like dancing. If you go too vigorous, you're gonna do something bad. If you are like really respecting the tissues, feeling it like it's, I will show you today, I mean, while we're injecting. You just do the opening, you put the cannula, it's a blunt, moving in the fat, it does not need any force. You have your other hand and on the top of the buttocks, so you feel the tip of the cannula, you are fine. Once you start to use your muscles, then this is when you should expect problems. Other than that, everything is, I mean, 0 complications. I mean, some infections, if we are speaking in general, infections, irregularity, if you are not injecting in a fan shape, because I do inject in a fan shape, very slowly, or very quickly, but the most important thing is that you have the same force. And after you're done, you do massage. So you don't have any problem. Sorry, nodules. Nodules like granuloma or nodules like filler collection? Which one? Granulomas, no. Okay, and even if you have a granuloma, deeply with the thickness of the skin, with the thickness of the fat, it's gonna be not. You will not. Neither you or the patient will feel it. Relocation of filler, like it becomes hard. Then also, I ask my client. It never happened, but I always tell my client after 3 to 4 days, just start to, while you're showering with soap, just make sure that everything is smooth. If you feel that there is a lump, just press on it. I mean, they never found anything. In the end, yes, this is a very good question because I remember something that I usually forget to say. In the first entry, I prefer to do some tracks, but not too much, because in the end, I mean, without injecting filler. So I move with my cannula just to prepare my field. But I don't do that a lot, because in the end, if you really dissect inside, you have a bigger space for the filler to move. At the end, you do one track, so that she's not feeling pain. Maybe after every 3 to 4 times you move your cannula, she might feel a little pain, then it's fine, but bearable. But in the end, I don't dissect like too much with my cannula, so the filler movement is going to be limited to the track that you have done. Okay? You're welcome. Any more questions? All right, so now we move to the next product. It's going to take like a couple of minutes, which is the first polylactic acid in liquid form.
What is going to be your point of entry and the direction that you're going to direct your cannula?
The direction is going to be this way most of the time. I said, if you want to have contouring, then you inject here. If you want to have full volume, you inject here, 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 and here. Okay?
From this side to here. From point 3. Okay.
You mean the direction? yes, the direction is going to be whatever. I don't care about the direction. I don't care about the entry point. The most important that we care about is the area of injection. So if you're right-handed, you're going to be from this side. If you're left-handed, I think you're going to be from this side. So it does not matter. What matters is where you are going to place your fillers. The point of entry can be here, depending on my length of the cannula. If it's short, it's going to be here. If it's short, it's going to be here. I don't know. It depends. It depends on the length of your cannula. I prefer the 12 centimeter ones, or even longer, but in the end, 12 one is fine. Usually, your point of entry, if it's 12, is going to be around here. Usually. In the end, you choose the point that you feel you are able to cover all the area. Yeah. Yeah. 18. 18 or 16. Okay. So shall we wait for the doctor? Or hey? He already saw. Okay. Well, Reach PL is a very good product. It's the first polylactic acid in liquid form. Of course, there is a competitor who is manufacturing polylactic acid, but not in a liquid form. Polylactic acid, it's an amazing material. It's an amazing ingredient that it's a beautiful molecule. It helps a lot in rebuilding fibrin, collagen, regaining the skin texture and firmness. It helps also, it is very useful also in cellular reprogramming and inducing fibroblasts to create also more collagen, more elastin. But the problem with the competitor is not about the quality. It's about some logistics. The first thing is that it is expensive. The second thing is that you need to dilute it 24 to 48 hours before using it. So this is such a loss of opportunity. And the vial is also enough for 3 to 4 patients, actually 3 patients. So you need to gather all those 3 patients on the same day, or at least in 2 days, and this is a difficult logistical problem. After 4 to 5 days, you need to trash your vial because it's useless. So we have created the first polylactic acid in a liquid form. How did our R&D develop that? They developed that because they have reconstituted the polylactic acid in hyaluronic acid. To have a ready-to-use, do we have the product? Okay, so anyway, I don't know, we had one open, but it's fine, it's fine, it's fine. It's fine, we can show it to them in the practical part. It's okay. So this is going to be the vial. I'll show you an open vial later. It has polylactic acid dissolved in hyaluronic acid. The hyaluronic acid concentration is 20 milligrams per milliliter. It's cross-linked with BDDE in low concentration. So it's a very useful product because in the end you need it for the other polylactic acid company. You needed at least 2 to 3 months to start seeing the result. The final result usually needed 6 to 8 more months to show. So this is very useful because the patient will have an immediate effect thanks to the hyaluronic acid injection. I usually inject in the face around 1.5 ml per side, so the vial is enough for at least 3 patients. And then for the body, I usually use 3 milliliters per side, so this is around 6, so the vial is around, it can be enough for around 2 clients. That's all. So I prefer to do 2 to 3 sessions, 1 month to 60 days apart, depending on the skin texture. If the patient has a very good skin texture and she's just starting to have sagginess, I would prefer to do a session every 2 months. If she is very old or aged skin, for those people who are working in the outdoors in the sun, then I would suggest to do it every month for 3 sessions. I have only one picture of before and after that I want to show you. And this is after 3 days. This is not the result is not for the polylactic acid. This is after 3 days, so you can see that the hyaluronic acid has already done a decent job when it comes to having the wrinkles sorted out, and the patient is going to have a more beautiful result after 2 to 3 months. That's all. And does anybody have any question? All right, so now we move to the practical part. Okay. For you? Okay. So I have my 20 ml syringe. I open the cap. I just hit it 1 or 2 times. Okay. And then, of course, until now, this is sterile. Everything that has touched it is sterile. So, okay. This one inside. Okay. And there you go. Sorry? Thixotropic effect. This one is going to be a little bit difficult because I didn't add any air to it. So it's against negative pressure. I don't know. 20 ml. Okay, so I put that aside. I take one more. Very simple, right? I wait a little bit until my filler is having enough fold because otherwise it will start to absorb water. So it's much easier. I didn't add any saline solution or physiological solution yet. I will add a little bit to the last 10 ml just to increase the dilution of it, so it's much easier to take out. Can you see? Oh, sorry. You're only. Okay. For the rest, I will add like 4 ml of saline solution. I add them inside. To help keep the same concentration, I would usually separate each vial alone, so that, you know, in the end it's 50. I shake it very well. I wait a little bit until all the solution is down. I put my syringe and I withdraw it slowly so that I don't get much air. That's it, and that's all. It's empty. Took me like around 2-3 minutes. And now I'm ready. So I have 1, 2, 3. This is around 50. Now we have our client. Okay. All right. So where is our client? Sorry? So for this case, we're going to add 150. So that's like 50 and 50, 60 and 60. And then this one, I can put 5 ml and 5 ml. Hey, this is very difficult, very difficult. Hello, how are you? I'm good. Can we have a look?
Yes. To everyone.
I see first.
Okay.
Okay. Okay. Can you hold these ones for me, please?
What?
Can you hold these ones? To the front, to the front, to the front. Yeah. Okay. All right. Okay. Yeah, that's fine. Okay, so can you please turn around? Okay. All right, so can you please, no, not you. Can you please zoom in with the camera? Okay. Well, the light is not the best. Do you have a ring? So, for now, until they bring some lights, can you please tell me what don't you like about the shape of your buttocks?
I think I need a little bit more.
A little bit more. Where?
Here.
Where? No.
Here.
No, here is very good. Here's actually it's a little bit saggy. But actually we want to put more here to help lift it up. When you have corrected this sagness, you're going to feel that there's some volume that is here. Also, you have some extra skin. I mean, the skin is a little bit saggy. It's not like really... how old are you?
31.
31. Okay. Did you lose weight?
A little bit.
How many kilograms?
Like 10.
10. Okay. So most of the sagness is because of the 10 kilograms. Okay. Today we're going to inject some fillers here. It will help you a lot to It's okay, it's okay. Oh, okay. You're yeah. Okay. All right, so just a little bit like that.
Okay.
Yeah. All right, so if we look here, there's the lateral depressions. Yeah. Same as here. Okay. So my main injections are going to be in the upper quadrant, upper lateral quadrant, to help lifting, and at the same time it will give some volume, some roundness. So this is my plan. Do you like it? Okay. So second point is going to be I will take some pictures, 5 positions, and then we will start with a drawing. All right. Okay. I have my phone. It's somewhere here. Thank you. Okay, so I just need a background, so can you go a little bit to the front? A little bit to the front. I will take your position for a while. Okay, 45. Yep. Okay. Okay. 90. Yeah. Okay. The opposite. Yeah. Okay, now we're done. Okay, so nothing, just I need the pen. I have the pen here. Okay, so turn back again, please. Turn back again. I'll just do some drawings. Okay, so I want you to contract your muscles. Okay, relax. Contract. Okay. Contract. Okay. Contract again. Do we have another pen? Or do we have another it's a white one? You have another white? We have another marker. It's white. No, we have the surgical one that is white for yesterday. Oh, you have a sharpener?
Yeah.
Okay.
I have everything.
Okay. Okay, good. Thank you. So I just drew where I want to keep my filler, mainly, and then I will do the drawing. I think this is a defective area that I want to fill. Anyway, I proceed again with my drawing. So I divide the region into 3 equal compartments. I will not go anywhere with my fillers here because here is going to be saggy. I divide the buttocks in the and then into half, so it's like here. And then you get 1, 2, 3, 4. Anyway, this one, the line is not really 100%, but anyway, my main fillers are going to be in the upper quadrant. That's her most need. So anyway, I'll inject here. We will do the same here, so it's like that and like that. No, equal. This one is a little bit not equal. Okay, so we start with our drawings. We start with injections. Okay, you're done. So please, can you sleep here? Are you scared? Yes, please. Okay. All right, so I will prepare my anesthesia. I'll prepare everything and then I change my gloves. So, do we have anything to sterilize with beside alcohol? Alcohol for me is okay, but do we have anything else? Do you have anything else? Okay. All right, so I first start with bringing my cannula and checking where do I want to inject. So if I want to be here, then my opening should be here. Right? In this case, I'll be able to move in that way. I'll be able to inject here. So my point is going to be right there. So I take my pen. I can't remember where I left it, but anyway. Thank you. So I mark here. Okay? On the side, I measure, I see, okay, my cannula should be here. All right, so for me to be able to inject, I need to be here. Or even here. Okay? Then I inject my anesthesia. And this should be the last thing that the patient should feel. I'll just change my gloves. So I will start with this side. Anesthesia. So you will feel a needle prick here, okay? Sorry, I lied. So I injected 0.5. Here as well, I will do the same. Is it painful? Is it painful? Okay, I'm done anyway. So for the rest, you will only feel a discomfort, something that is moving inside, but you shouldn't feel any more pain. Okay? I connect my cannula. I load it. Okay, I close it back. Do you feel this prick? Do you feel it? What about this one? So you don't feel this one? Okay. That's great. I made my opening. It's okay, I already, yeah. So do you feel any pain? All right, very simple. And then I will start to do my tracks. Sorry. Sometimes you will feel some things. Is it painful or, because I can feel you're laughing. Okay. So anyway, I start my injections. Slowly, slowly. Painful?
No.
Okay. So I usually use my second hand as a brain hand. I start to feel the depth of my cannula. From time to time, it's good to see how much tissues you have on top of your cannula. I think my level is fine. My patient does not feel anything. Actually, if you used a 10 ml syringes, it will be much easier for your injection. Anyway, it's very easy. I inject slowly. Okay, so now I move a little bit more to another spot. Ooh, too much pressure, sorry. Okay. I usually leave my cannula inside. You don't feel any pain?
No.
Me neither. But you feel something is moving, right? Yeah, very easy. No, not me. I didn't fall down. Sorry. Yeah?
Can you mix product instead of saline with lidocaine
Why? She's not in pain.
to add like a little bit of anesthesia?
I didn't put for her anything. I just put half an ml of lidocaine here. She's fully awake. She's nervous. She was scared a little bit. But so for all the clients that you will have, you shouldn't, if you're on the right layer, you shouldn't have any pain. It's the same question that I used to have always when it comes to threads. Can I inject in the full track? But why? If you are in the right level, the patient should not be feeling you. He will feel that there is something that is moving, but he shouldn't be feeling pain. So she feels that there is movement, but she does not feel pain. So if only these syringes have been 10 mLs, it would have been much easier to inject. I mean, I would have finished at least one side by now. Now it's a little bit, the force is a little, you need to apply a higher force. But anyway, other than that, she's not in pain, she's not moving, she's fine. Did you tell her that you are in pain and you didn't? Okay. Okay. Yeah. No pain, no gain. Okay, we're almost done anyway. Yeah, sure. Yeah. Ready? Okay, I'll change my glove. You can keep this one. We need 10 ml syringes. No, not now, just for the next case. Yeah, sure. Wait until the opposite side. I'm just coming for you. Just put some gloves on. Okay. Yeah. This is where I put my fillers. So you can feel the harnesses until here. So I would even suggest to do where's the anesthesia? I'm just looking for the anesthesia. Yep, it's right there. Okay. So, an opening for you.
Ahorita no estábamos haciendo nada.
You wanna get it in? You?
Ya.
Hold it. So you go perpendicular first, and then you take. Okay? But this one is the 20 cc. It's a little bit difficult to inject. I've been doing workshops on that one many times with a 10 ml. I never had to use such an amount of force. Today we had shortage, so I used this one. Anyway, it's just gonna be fine. Please. Yep. Just a little bit, yeah. So you see. Good job. Now move a little bit forward. Yeah, right?
Una foto. ¿Me tomas una foto?
Okay, I'll show you something now when you're done. Go.
No, no more?
No, finish it. Okay, finished? Don't take it out. Wait, I want to show you something. I'll just empty this air, and then you can try with a 10 ml. You'll feel it's a different product. To the medial? Now, this area is not to be injected, okay? But why would you want to add to the medial? Like all of them? You can put your opening here, there, whatever you feel comfortable in. Everything is possible as long as, sorry, okay. Take this one, I'll do it for you. Try. Yep, this one, here. Yep.
No, only this?
Yep. You feel a difference?
Yeah.
Yes, right? 10 mLs. No, it's okay. Let me just see. Okay, so I'll just go from here. Okay, I'll inject very easily. Takes way less time, you see. We're done. Okay.
Yes, thank you very much.
You're welcome. I'll add some more for this side. So anyway, I'll leave this one in here. Yeah. Okay, in 1 minute. Can I reply to you in 1 minute? I'll just finish that, and then I will be totally with you. Okay, tell me your question.
When you're putting the rivet,
Mhm.
you make continuous pressing of the. It doesn't matter if you're
Retrograde or antegrade? Yeah.
Well, you never stop applying, like you're always pressing.
No, I decrease my pressure. I mean, it's this one was really heavy. I mean the 20. So you will not be. I mean, my hand were even shaking. So for the 10, you will notice that I'm only injecting on the retrograde.
Okay.
So
Is it better to use a 10?
way better
Because
if you want.
less
It's less pressure. Yeah. Are you still in pain? No. You're done with this side already. Okay, I'm done with this side. So I massage my material. Sorry. Okay, so can you please stand up for me? Can you please stand up for me? Okay. Yes, please. You see a difference between both? Which one is better? Okay. Okay. And this effect is going to be even better after 10 days. I need 10 ml. 15, 10 ml syringes. Hey, come on, it's for the next session. Okay, this one I will just keep refilling. 15. Hey, you see, we were dying. I almost sweated. Because on the 20, it's really difficult to push. Yeah, but I mean, even without a lower lock, if the pressure is not too much, it never splits. But this one was like too much. Did you see? You like it? Okay. So I will just prepare the rest. Was it painful?
And it was strange.
It's strange. It's discomfort.
Yes.
Okay.
Mira, es extraño.
I would wait.
Y los nervios también, que los nervios que los expresan. Yo creo que es más también nervios.
Until she can exercise, just squatting.
1 week to 10 days. No, you don't have to take this one. Okay. Okay, so now we go to the other side. So I'll just do the other point of injection as well. So, who wanted to try? So I just made my opening. Yes, please. I'll just do the first one and then you can do. So I just create my passes, just a couple of them. Okay, and I can feel my cannula is right there. Okay, and then I'll give you in a few. I'll just prepare the track. Okay, so you can go. It's easy to inject? Not too difficult, right? Okay. Okay. So, perfect. Can I have some ghosts? Okay, so you can continue. Thank you. Here. Yeah. Finished? Okay. Okay. Do you feel any pain? Okay. All right. So, you're welcome. Yeah, you feel a little bit, I know. Okay, please. Okay, can you help me? Just hold it from down. Okay. 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 Sorry?
I feel a bit of
Super fibrosis.
yeah,
It's
that's okay?
yeah.
Am I too deep?
No, you're very fine. Actually, I think you're even a little bit superficial. It's fine. It's fine. Let me see. Okay, it's very good. Actually, you can wait a little bit, so I make another opening for you.
I'm sorry?
Que
yo me vaya al otro lado. Sí. Que me vaya al otro lado.
You want if you want to go to the opposite side, it's gonna be much easier for you to inject.
Sí, en la razón.
Okay. So you can go in this new opening.
Okay.
No more here. Okay. So can you please? Yeah. And then you go perpendicular.
Okay.
Okay, and then
I just wanna feel the depth.
take it out even and put it in again. Yeah?
Am I too superficial?
A little bit.
What I never
A little bit.
Okay. There?
Yeah, but just go.
Okay.
Because she has fibrosis, so anyway, don't worry, don't worry. Just fan shape, all this area. Here as well is okay. Here is okay. And here to there. Okay, let me help you. Okay, so
When I feel like resistance.
okay. Very easy. Just inject slowly, and you stop while going in. Go. Just use more pressure. Give me this one. Grab it. Go. Now you will feel more strong. Push, don't worry. Never too deep. With this cannula, never too deep. Sorry?
I'm done.
You're done? Okay. All right. Please.
You're a surgeon, that's why.
No, it really is very easy. It's very easy. You don't have to worry because all this region is just...
It's safe, right?
It's safe. Totally safe. Once you start to think that it's, okay, I'm too deep, oh my God, I'm just going to put it inside her ovaries. And this is why you will feel it uncomfortable. You're welcome. Yeah.
I know the first plan, but I want put in the model Buttocks
Okay.
to project
Yeah.
this the model.
Okay. For this patient. No, for this patient, okay, I never change my mind after she sleeps. Because in the end, she sees herself, her boyfriend, everybody, he will see her while she's standing, okay? So if she has a problem with the projection while she's standing, then definitely you should mark it. Anyway, if your question is, can I change my mind? I would prefer that I would ask her to stand up again and then reassess or do another session. You can always add more. The fillers is very easy to change. I mean, to add more. What else? Yeah, that's it. So.
If I prefer weight.
If you.
One
If,
week.
okay.
1 week.
Yeah.
To finish is good or no?
Yeah, yeah.
Yeah?
Yeah.
And prefer? Yes, no problem. Or
Oh, you mean you prefer to not to use the product that you already.
okay, because okay is
Well.
good. It's good for me. It's enough.
Well, yeah, but anyway, you should start with, let's say, 1 vial on each side, 50, 30. 30 is a little too little, to be honest. I mean, with the relative sizes of here, okay, it's going to be almost nothing. So if you want to have 50 and 50, then you don't have to keep anything in the fridge, and in the same time, you don't have to throw anything away. And then you can do a second session to add more. So let's say my plan for to add 100 and 100. Then I would put 50 today, and then 50 on another time. You're welcome. So now we have the last 20 ml. Yeah. Okay, so I clean. I massage very well. Sorry. Okay, can you please stand up for me? Can you please show us? So, regardless, okay, this is a workshop. We spent a lot of time speaking. I'm slow so that I show people the 20 ml, but in the end, it's going to take, and practically, it will take around 20 minutes in your clinic, 15 to 20 minutes, you're going to be done. You have a beautiful result. The patient is going to go home with an immediate result, happy. She doesn't have any complaints, zero downtime. She can go today to her work. She can do whatever she wants. Just an antibiotic and to avoid sitting down. Okay, so we take a couple of photos, and then you're good to go.
How many?
150 both sides, so 75 both sides.
75.
So this is 75. Okay. I think we had the light here. Wait 1 minute. Okay, 90. Okay, sorry, the middle again. Okay, 45. Okay, thank you so much. Thank you. All right, so that is all for today. Does anybody have any questions? Okay. Thank you. Thank you so much. Thank you, and I hope